So it's a great pleasure to be talking about the benefits of the UK Nepal collaboration, because I think I personally have benefited a lot from it. And I think my whole career at the moment is based on the cooperation between the UK and Nepal. So I was always interested in the UK. My brother was trained in Sandhurst during his military career, so when I got to go to Liverpool, I was very excited actually. Now, prior to going to the UK, I worked for a French organization called Médecins Sans Frontières, which actually means Doctors Without Borders, which I think most are familiar with. And working with them, I worked on a lot of epidemic outbreak situations: cholera, meningitis, Lassa fever, Ebola, etc. And I worked with them for 5 years, and during this process, I myself got falciparum malaria. And there were lots of cases where I came into contact with scientists from the CDC, from Epicentre, which is the research section of MSF. And I was aware that I had a lack of a critical way of analyzing things, of thinking in a scientific way, more or less. So I actually wanted to hone these skills, but I didn't know how to go about it until a friend of mine suggested that I do a course at the Liverpool School of Tropical Medicine. So with the help of MSF, with the financial help of MSF, I went to Liverpool, and though honestly it's not one of my favorite places, the year that I spent at the Royal Liverpool Hospital and at the School of Tropical Medicine was one of the best exposures I had. I worked with Dr. Christopher Barry, who is a world-renowned specialist on enteric fever, and it was only there that I realized what a big problem enteric fever was in Kathmandu. So through him, I got into contact with Dr. Jeremy Farrar, who is the director of the Wellcome Trust at the moment, but back in 2008 was the director of the Oxford University Clinical Research Unit in Vietnam. So there's a small Oxford University Clinical Research Unit, or OUCRU as we call ourselves, here in Patan Hospital where I work. And it was through Dr. Farrar that I actually came to Patan Hospital to work with OUCRU. So talking about OUCRU, so OUCRU Nepal is actually a small branch of OUCRU Vietnam, which is a major overseas program of the Wellcome Trust. The Wellcome Trust, most of you may know, but it's for those of you who don't know, it's a UK-based global charitable foundation that is dedicated to improving health worldwide. There are lots of MOPs worldwide. There's one in Vietnam, there's one in Thailand, there's one in Kenya. So the OUCRU Nepal is affiliated to OUCRU Vietnam, so we're just a smaller branch. And OUCRU has affiliations to the University of Oxford, and we've been active in Patan Hospital for the last 11 years. So we started back in 2003. And the main mission of OUCRU in Nepal is to build a strong critical mass of people, or scientists and clinicians, who can develop the future, the clinical and scientific future of Nepal. So we've been here 11 years, and we've generated a lot of data on neglected diseases. So our main focus is on neglected disease, such as enteric fever, because there's so little resource and so little research done on neglected diseases in the developing world. We work in close collaboration with the Nepal Health Research Council, the Nepal Public Health Foundation, the Britain-Nepal Medical Trust, Patan Hospital, and the Patan Academy of Health Sciences. And through the years, we've actually helped upgrade the laboratory facilities. We've set up a state-of-the-art molecular lab in Patan Hospital that runs real-time PCRs every day. We've got gene experts in, which has improved the diagnostic capability of the hospital. And through the Oxford affiliation, there are also 3 scientists who've done their doctorates, including me, from the University of Oxford in clinical medicine. And a lot of academic and non-academic training for clinicians, scientists. So overall, I think the affiliation has actually helped individuals within Patan Hospital to gain sort of like an independence in the international scientific arena. So I think OUCRU NP has actually been able to come up with an academic environment in the medical school, but also give evidence to clinicians to base their medical practices on, so which actually has made the hospital very happy, and it's made us very happy. So it was only through the Nepal Health Project that I actually found out that there were so many British organizations working within Nepal to And I was quite surprised. But you know, even though Nepal has made a lot of progress achieving the Millennium Development Goals, there's still a lot, almost 1/3 of the population that live below the poverty line. And health inequity, quality health services, there's a huge inequity, there's a huge gap, which is, I think, what we in PNMT are trying to focus on bridging. And I think the British support, not just in the development of the health sector, but in the primary education, is very important in allowing Nepalese to take responsible leadership to change the future of medicine and the way we practice medicine in Nepal.